Good morning, good afternoon, and good evening, everyone. I welcome you all to the 18th day of uninterrupted IFPH webinar sessions. Let's start our session with the silent prayer. Thank you all. And today's guest is uh, Dr. DILEEP Gujaria, Associate Professor in Department of Community Medicine, ex-Senior Medical Officer, DHMC Ratlam. He is having more than 15 years of clinical and teaching experience, and now he is here to present on the topic of knowledge of community medicine for homeopathic practice. I welcome you, Dr. DILEEP Gujaria. You can start the session, sir.
Hello, sir. Hello, everybody. Myself, Dr. DILEEP Gujaria from Rajasthan Vidyapeeth, Udaipur. Today we talk on topic something is different from regular topic discussion at your forum, IFPH. We talk about knowledge of community medicine, homeopathic practice. My voice is clear?
Yes, sir. Yes, sir.
Okay. Because there is something technical error. Okay.
So you can share by clicking on the green.
Yes. I am sharing. 1 minute. There is some technical error or network error.
You find it difficult.
No, sorry. Yes.
Dr. Naveen Kumar Vaishnavi, sir. Sir, can you share the video? I shall send it to you. Vaishnavi, sir. Dr. Vaishnavi, sir. And Naveen Kumar Vaishnavi, sir. Can you share the videos, the PPT, if I share it to you?
Yes, sir. Good evening, sir. Please share it with me.
Okay, sir. I shall share it now.
Yes. Okay.
Dr. DILEEP, are you able to share?
Sir, 1 minute, sir. I'm sharing. थोड़ा सा टेक्निकल एरर रहा है इसमें. 1 minute. PPT is not supported in this on my application, so that I am sharing PDF.
Sir, I have sent it to Dr. Naveen Kumar Vaishnavi. Dileep sir, you may wait so that Naveen and Doctor you can just say something about your. In between, I shall say something about the 5th anniversary celebration of IFBH. Dear doctors and homeopathy lovers, we, the IFBH, are conducting the 5th anniversary celebration on Cochin on 28th September at Cochin, Taj Vivada. It's a 5-star hotel from Taj Group, and it is a big day for us, which is the first time that such a celebration is going on from IBH here in Kerala. And we invite all of you to come over there, and please register yourself before August 31st. We have a booking fee, a registration fee of 3,000. So hope all of you will register so that we can meet one another. And there are a lot of science discussion, lot of scientific presentations, a lot of interactive sessions, and at the end there will be a big cultural program from our doctors and homeopathic lovers too. Hope all of you will join us before the date. Okay, thank you. Dr. Naveen, sir, you are co-host and you can share whether you are joining from another laptop or... Yes. Yes, Dileep, sir, you can begin the session already.
Sir, see my slide on your screen, sir.
Yes, it is visible, Dr. Dileep.
It's visible.
Okay, start, sir. Today we talk on knowledge of community medicine for homeopathic practice. In this session, I am discussing on community role of community medicine in practice of homeopathy. Homeopathy, as we know, homeopathy is a holistic system of medicine, and community medicine is talk about prevention and promotion and social determinants of health. Homeopathy is talk about individualization, but homeopathy knowledge of individualization is not alone like that. We all know homeopathy ourselves treating individual. We carefully understand each patient constitution, mind and body before prescribing. But let us pause and ask ourselves, does the individual lives in isolation? No. No anybody live in isolation. Each patient is part of a family, a community and a society that shapes their health, and that is where community medicine becomes essential. I like to say, if clinical homeopathy is our heart, then community medicine is the backbone that makes our work socially relevant. On that topic, I am talking about bridging the individual and community. Community medicine widens our vision. It teaches us to look not only at the patient in front of us, but also at the environment, lifestyle, and social conditions that contributes to disease. For example, when a child comes with repeated respiratory infections, a homeopath may prescribe the right remedy. But community medicine asks us, does the child live near polluted air or in a damp house, or is the family suffering from malnutrition? Unless we address those factors, true healing remains incomplete. In that manner, we talk only about disease, but in light of community medicine, we talk about the environment surrounding the patient, which affect the patient's health, which stimulate the disease conditions, and community medicine increase our knowledge about these environmental conditions. And we talk about prevention, homeopathic prophylaxis, and the word is cure. I think cure word is bottom of the community medicine, and cure word arrived from community medicine because of cure is what? Cure is that remove the disease from root. And what is root? Root cause is known by, or we know about root cause from the knowledge of community medicine. Prevention is better than cure, we say. We often quote Hahnemann as the father of homeopathy, but let us also remember that he was a strong advocate of prevention and hygiene. And community medicine also focus on prevention and hygiene. Community medicine brings this prevent aspect alive. It equips us to identify risk factors in populations, education families on nutrition, hygiene, and mental well-being. And most importantly, prevent epidemics by using the concept of genus epidemicus. This makes homeopathy not just a curative art, but a preventive science as well. So that we know homeopathy is a talk about genus epidemicus, and epidemicus also teaching community medicine. Community medicine always enhance the knowledge of surroundings, enhance the knowledge around the whole community, and this wide our vision about patient and patient surroundings. Most important, prevent epidemics by using the concept of genus epidemicus. This point is arrived from community medicine. This makes homeopathy not just a curative art, but a preventive science as well. Real life impactful examples, if we talk about this, some powerful examples that highlight this synergy. Chikungunya in Kerala 2006 outbreaks, when thousands of people are affected, the government distributed the homeopathic remedy, Bryonia alba, I think, as a preventive medicine. This impact was remarkable, reducing both incidence and sufferings. In case of chikungunya, and another case, we see COVID-19 pandemic in 2020. We all witnessed how arsenicum album 30 was recommended by the Ministry of Ayush as an immunity booster. Millions across India received it through community level distribution, while conventional medicines worked on managing critical cases. Homeopathy contributed at the preventive front. School health programs also as real life examples. In Madhya Pradesh, if we talk about state health programs, school health programs in Madhya Pradesh, in West Bengal, and many homeopathic colleges regularly conduct school health checkup programs in school. Children with anemia, malnutrition, skin disorders are detected. Why? Because of early detection is achieve early cure. Treated safely, rural health mission, as we know in Rajasthan, in underserved village, homeopathic doctors reach people who have little access to healthcare. We address chronic disease, menstrual problems, malnutrition, and lifestyle disorders conditions often ignored by the mainstreams. In many real life examples, we know each of these examples shows how community medicine extends the reach of homeopathy from the clinic to the community. Research and evidence building. Government focus on this topic. Today, we know community medicine is included as a postgraduate course, and in undergraduate course, community medicine subject renamed with research methodology and biostatistics. Government focus on research evidence based practice, because of many times we face these problems. Sometimes so and so person tells homeopathy is not just a placebo, it's a fake science, blah blah blah. When he tells us what is the base of your homeopathy, what is your evidence about the disease cure, what is your evidence about a cure, what is about your evidence about your medicine, what is the method, many more things, other pathies, other mens, and other critics are also called this. So that research methodology and evidence based practice are another basic tool for this, and this critics strong answer. Research evidence building, another gift of the community medicine, because of there is epidemiology and biostatistics are the basic tool of community medicine. These are not just academic terms, they help us collect data by the surveys, conduct conduct surveys and publish results that strengthens the scientific credibility of homeopathy worldwide. Imagine the power of documenting how a genus epidemicus reduce a take, how a genus epidemic reduce attack in a community, or how homeopathic interventions improve nutrition and mental health outcomes. That is how we make homeopathy heard on the global stage. So that this community medicine is a tool for establishing a research evidence document for homeopathic support. Holistic impact, if we talk about this, friends, our role as a homeopath is not limited to prescribing remedies. We are also health educators, preventers of disease, and advocates for healthy living. By embracing community medicine, we become guardians of public health, working in schools, industries, villages, and urban communities alike. Homeopathy integration improves patient care and public health impact, and majority of diseases are preventable, and community medicine is focused on prevention, helps in early detection and prevention, understanding the community health needs, enhance role in national health programs. This is a community medicine's role for a homeopath. If we talk about prevention, primordial health, healthy lifestyle promotion, primary immunization, health education, secondary screening, early diagnosis, rehabilitation, disability limitations, these all are suggested and advised by community medicine. Community medicine also helps for study of health problems in population, tools just like survey, epidemiology, screening. This is a very good tools for help us for community diagnosis. Helps in planning for prevention and promotive measures for a homeopath as a whole health advisor. Role of homeopath in community medicine, if we talk about this, clinical role like diagnosis, treatment, follow-up. If we talk about preventive roles, education, awareness, prophylaxis, and if we talk about research role of a homeopath is in case of documenting of cases, outcomes, and community surveys. As we talk about a role of homeopath as a public health is a participation in government health programs, and this will teach by community medicine. Social and behavioral aspects, influence of diet, lifestyle addictions, stress on health. Homeopathy as a counselor and motivator, this all influence affect the health of human being and affect the disease conditions. As a homeopath, we advise and we counsel the patient, and thus this knowledge is given by community medicine. Importance of health communication skills is given by community medicine. If we talk about national health programs, the knowledge will be given by community medicine. TB, National Tuberculosis Elimination Programs, HIV/AIDS programs, immunization, nutrition programs, RMNCH program, NCD, National Non-Communicable Disease Control Program, hypertension, diabetes, cancer, all are non-communicable disease, and government run programs for this. Integration of homeopathy in Ayush initiatives all are also a new era for homeopath. As we talk about environment and occupational health, safe water, sanitation, waste disposal, this all are knowledge improvised by community medicine. Pollution and health hazards are teach in community medicine, and we know about the knowledge from these sites. Homeopathy's role in early detection of occupational disease is an important role, and this is a very new era for a new work style for homeopath as a occupational disease control. एपिडेमोलॉजी बेसिक्स ऑफ प्रिंसिपल्स की बात करें, एपिडेमोलॉजी बेसिक्स ऑफ प्रैक्टिस, इंसिडेंस, प्रिवलेंस, risk factor, causation, outbreak investigation basics, and evidence-based practice in homeopathy. These all are strengthening by knowledge of community medicine. Homeopathy and public health success, a combined picture of homeopathy and community medicine, study of community medicine or knowledge of community medicine, is that epidemic prophylaxis, just like Japanese encephalitis, dengue, chikungunya, influenza. We talked earlier about this live examples. Integration in school health programs, case documentation. Why forward for homeopathic consultants? Strengthening the knowledge of community medicine. Strengthen the knowledge of community medicine for homeopath. Active role in community health initiatives for homeopath. Collaborate the public health authorities, promote holistic health at both individual and community levels. So let me leave you with us this thought. Community medicine gives us the wings to take homeopathy beyond the consulting room into families, schools, workplace, and entire populations. It empowers us to prevent disease, promote health, and brings homeopathy into the mainstream of public health. If clinical homeopathy is our heart, then community medicine is truly our backbone. Homeopaths are not only clinician but also a public health partners. Community medicine enhance reach, relevance, and responsibility, so that we say, in short, healthy individual, healthy community, and healthy nation. Thank you.
Dr. Saida, you can speak now. Yes, Dr. DILEEP Gujaria, sir. It's really a very good session.
Yes, sir.
Unfortunately, we couldn't upload the PPT as there was some network problem with the Dr. Naveen Vaishnavi also. So that's the reason why he couldn't upload the same.
Yes, sir. Yes, sir.
Anyway, we need to concentrate on this aspect because community medicine is one of the area where homeopathic topics can do wonders because we need a lot of public support for maintaining our system as well as propagating homeopathy also. Yes, Dr. Saida, you can speak. Those who want to speak can raise your hand so that we will allow you to unmute yourself. So, and you can. Doctor, what is the present situation of homeopathy in your place? Yes, please unmute, Doctor. What is
Sorry,
the
sir.
What is the present situation of homeopathy in your place? Whether it is growing like anything and Doctors are getting a lot of patients, and what kind of support you are getting from the government in this aspect? Uh,
Sorry, sir. I can't hear your voice clear.
Oh, good. Your network may be a little bit weak. That's the reason why you could.
Yes, sir.
That is also another big problem.
There is some weather problem here.
Okay, that may be. Now, can you hear me? Sir, the question is that what is the present situation of homeopathy in your place? Whether the doctors are getting a very good number of cases, and you are getting lot, what kind of support from the government in your land? Yes. Dr.
Doctor,
Smith?
can you hear me now?
Yes, yes. And now we can see you.
Okay. Yes. Yes. Thank you, Dr. Dilip Gujaria. Your presentation and your session was really very nice, and thank you for your session. And there is an announcement also. We, the IFPH family, is going to celebrate the 5th year celebration of uninterrupted webinar sessions. It is going to held on 28th September at Hotel Taj Vivanda, Cochin, Kerala. If anyone is interested to join the session also, you can contact through the number of 9207 433 You can contact through this number also, or you can contact Dr. Shaji Varghese also.
Yes, as you know, the International Forum for Promoting Homeopathy was formed at the time of COVID, when there was no way to communicate between the doctors around the world. And a group of people, that is particularly homeopathic lovers, along with Dr. Shaji Kudiyat and some of the doctors here in Kerala, started such a forum. And we began the session with a simple presentation from Malayalam, and then we started our English session also and later when we reached 1,000 session, then we started our Hindi session. Thereby 3 sessions are going. All these sessions are daily going in a good way. The session begins at 7:30 to 8:30 in Hindi, and from 8:30 to 9:30 in English, and 9:30 to 10:30 in Malayalam. The purpose of this forum is to take homeopathy to every home around the world. And we are uploading the videos of the presentations on the very next day itself, so that homeopathy doctors, homeopathic lovers, and those who are interested in homeopathy can watch. Because there is a feeling that homeopathy is only for children, in most of the people believe in that way. So after watching, they can understand what is happening with homeopathy around the world. We have presentations from 65 countries, and doctors as well as eminent personalities from a different sector, particularly in the health sector, came over here and presented different subjects. And we have celebrations every 100 day, and there was a big celebration at our 1,000 day celebration that was held in Trivandrum, Kerala. And that was also a big session. There was more than 250 participants there. All these things are uh, 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 going in a good way, and hope all of you will come over. So we are inviting all of you to Kerala, because you know that Kerala is supposed to be a God's own country. Not only that, homeopathy is the dream place for everyone in here in Kerala. We have at least 5 to 8 doctors every 2 square kilometers. That means that homeopathy is propagating in a very, very good way, and most of the doctors have very good practice. We have in Kerala, there are 5 homeopathic medical colleges. All of them are under government sector, because the payment is made by government, and they are getting UGC salary. And there are 40 for government hospitals in Kerala with the 25 beds each in all these hospitals, and we have some special homeopathic directorate here, and there are more than 1,000 government homeopathic dispensaries, and all the doctors are getting all those doctors are officially designated personality, so that they can sign whatever paper they come over the way. So suppose they are also gazetted officers now. So the system here in Kerala has grown in such a way. It is because of the dedication of the private practitioners, in particular in the early days, because we have connections with the politicians who came over to homeopathic treatment and got wonderful result, and as a result, they were willing to adopt homeopathy in a big way. And homeopathy, that's how the homeopathic medical education came out here. And first it was D.H.M. and then B.H.M.S. and now B.H.M.S. and MD is doing here. And we are about to start our DM course also shortly. Everything is getting underway. And as you know, this means that homeopathy is as equivalent to any other profession, just like we are getting a lot of good patients in even more than 100 to 200 patients in every government dispensaries, and there are doctors who are having more than 300 to 400 OP every day. And this is because of the dedication of our professionals, typically homeopathic doctors. They're trying to study. We have a different organization for doctors, particularly the institutions of Homeopathy Kerala, that is known as ISK, then IHMA, and that is another big organization. All these organizations are making study seminars every monthly in their own district as well as local level also. That means the purpose of those forums is to educate the doctors and make them in a better doctors. So these are the things that each and every doctor need to undertake these things, not simply for getting some certificate to practice homeopathy, but it is not like that. To improve the quality of the doctors. Once the quality of the doctors is improved, naturally the community will be community services given by the doctors also in a good way improved. So that's what is all these associations are also doing. And then what we IFBH is doing is just taking homeopathy to public. We have a lot of homeopathy lovers with us. So they will demand what are the things required for betterment of homeopathy, what are the things they need, and so they can directly approach the government also for that. So thereby the government can give more importance to homeopathy. So this is what I would like to add. Dr. DILEEP Gujaria, sir, you might have heard about Kerala. Have you ever visited any of the homeopathic medical colleges in Kerala as a invigilator or an examiner? Can you hear me, sir? Because the network is poor. That's the reason why we couldn't communicate here in this forum. Definitely, the importance of community medicine is that whenever such a communicable disease comes into the picture, we have to reach to the community and to make them back to health by giving, not only simply giving medicines, but also we have to ask the people and panchayat to give the best services to the community, so that they can, for example, they need better water supply, they need better quality of life by giving lot of sanitary work, because most of the people in the early era, people have no such sanitary things. But nowadays things are improved. For example, some 30 years back when I started my clinic, we used to treat patients for bio compliance, and when we give some medicine for that, more than 500 to 700 worms may be expelled in that time. But nowadays things are entirely different. Not even a single worm come out. Even the so-called allopathic medicines were given by those people for these children, because that kind of improvement that has happened. That's a big revolution in the health sector. But now the scenario is different. What is that? The scenario, the change of the scenario is that most of the particularly the contagious diseases, particularly viral diseases, are spreading like anything. As you know, as everyone know that homeopathy has a solution for these viral diseases, because we never treat the patient, we never treat the disease, but instead we treat the patient. But what is the basic difference between the patient and the disease? That is a big question asked by some people. Oh, why are you saying like that? A patient who is having disease is a patient. A person who is suffering from disease is known as a patient. Then why you say that homeopathy is treating the patient? Allopathy is also treating the patient, but the thing is different. For example, when you get a viral fever, the patient himself suffer from myself may be suffering from body pain and ache, and I may be covering my head and body at the time of fever. But Dr. Seda, whenever having fever, she is sitting under the fan and using fan, and she is taking cold water. But I am taking, I may not take anything, even water also, but she may be taking lot of water at a time. So this is the basic difference between Dr. Danesh and Dr. Seda when during fever. So that's why Dr. Danesh is a different person, patient, and Dr. Seda is a different patient, even though they have the same viral disease. So in those conditions, the treatment plan of the doctor need to be changed. And sometimes I may have the worry, oh, I may die because of this fever. Seda may say, oh, no problem. I don't want any medicine. I may survive even without medicine. So that is the attitude. So that is the basic difference between two patients. So this is what we call as the differentiation in patient's nature. A patient from a disorder may react to the situation. Two patients may react to a disease condition in two different ways. So that difference is the basic difference we need to take into consideration, and we have to treat that patient in that way. That is the reason why we say that homeopathy is just like mathematics. When a patient come over here and he's telling a lot of symptoms, we may write down all these things. But after writing down the symptoms, what a physician has to do is that you just eliminate the total symptoms. You just write down the total symptoms and then remove the symptoms of common to the patient as well as common to the disease. Then you get some symptoms in the last part. That is the rare. That is a rare peculiar symptom, particularly for the patient alone. So in that, then you can prescribe on that symptom, and that will work. That's what is we call the individualization. That's how each and every case need to be individualized, and thereby you can treat the patient in a better way rather than simply writing about the symptoms and repertorizing this and that, and find that, oh, you get 100 remedies for a fever condition, and how will you choose the right remedy? That is a big question. So then in those conditions, what you have to do is that you have to look into the mind of the patient and see the stress. You would like to give more stress to the mind condition, and then you can choose the right remedy in that way. Then you may get some 3 to 5 remedies. Then you will have to compare the medicines that you got in the repertorization with that in the materia medica, so that you will find the right remedy, and that right remedy, when applied to the patient, will work in a beautiful way, and you will get the result in the shortest possible time. This is what a homeopathy need to do. When you are doing this kind of things, definitely the patient will propagate, will tell his story that, oh, doctor, when I was using a lot of medicine throughout my life with antibiotic and other things, I have a regular attack of fever, but after taking homeopathic medicine, I feel that my resistance is much better than what it was previously. So in those conditions, homeopathy works in a better way than any other system. So this is what I would like to add to the session. And if anybody has any doubt, you can ask Dr. Dileep Gujaria. Still has some problem with his network. I think the doctor, can you speak? Dr. Ramprasad sir, can you speak for a while? Yes, please unmute.
Thank you, Dr. Dhanesh ji and Dr. R. Sweta. Very good describe the Dr. DILEEP GUJARIA, but network is a very poor and problem. Community health, medicine and practice. I live at North Bihar, Supol. It is flood area. Flood area 2008 and 2004 flood community medicine and camp, homeopathic camp, collaboration, Red Cross and uh, district magistrate allow homeopathic medical association. This is the community health care uh, flood area. Very nice, good result. Arsenic album, flood area camphor, and viral fever, variolinum, influenza, dysentery को is a marvelous treatment. Dysentery, bloody dysentery, mark salt, and natrum salt is a good remedy, community health, community medicine, and natrum salt, dalka mara. Flood area is a very important role of community medicine and symptom according to symptom homeopathic select homeopathic medicine. So very thanks Dr. Dileep Gujaria. Network problem. Thank you.
Yes, if anybody has any question, you can raise it or you can talk to. I'm inviting Professor Dr. Jose Isaac sir to say a few words on community medicine, the importance of community medicine in the society, sir. Yes, as we all know that homeopathy has a preventive, has excellent work in the preventive sector also. Whenever there is an acute illness, particularly the viral diseases, you can give some medicine for as a preventive. But how will you choose the preventive? That is a big question, and there is $1 million question also in that way. Because in those conditions, what we do is the common symptoms of the patient used to be from that area need to be considered, and after repertorization, we can choose a remedy accordingly. At the time of chikungunya in Kerala, some 2007, I think, we used to give first it was Epitorium perfoliatum in some areas, and in some other areas it was Stokes, and some area it is Brownia. So it does not mean that you will have to give all the same medicine everywhere at the same time, but you have to choose according to the symptomatology in that particular area. That is the best thing we can do. But at the time of COVID, what it was, how the CCR selected the arsenicum album as the preventive was that they collected the symptoms from different part of the patients in different part of the world, and particularly in those areas where it was prevalent at the time, and they repertorized the case, and after repertorizing, they found that arsenic album has more similarity with that disease in terms of the COVID, and as a result, it was they chose arsenic album therapy as the preventive, and that's how it was distributed. As you all know that it was in the Gulf, it was hit heavily before the situation in India, and as a result, people from Kerala who used to use who use homeopathy medicine as preventive has got excellent result. After getting those results, they came up with the videos and audios, and they propagated it the same in Kerala and everywhere. And as people gradually coming towards homeopathy for collecting this arsenic amalgam as a preventive, and later the government also started giving government machinery also allow people to give you take this arsenic amalgam. In those days, the number of COVID cases were comparatively less, and the death from COVID also was less. But once the vaccine came out here, people rushed towards the vaccine, and what happened was that after taking the vaccines, they started getting the so-called fever, and when it was tested, they found that it is COVID positive, and the government and the machinery has given has exaggerated the number of patients in that way. Actually, there are patients who are there are persons also having no fever, but they were tested positive, and because of that only they were given in the list of as patients. And after taking the medicines, some of the vaccines, some of the most of the people have developed fever, and when they tested positive, the fever spread in their community, their fever, and people around them also, and as a result, that was the first wave of COVID, the so-called first wave of COVID. And after some time, they came out with another uh, thing that the first vaccine is not effective now, so you have to give a booster dose. And after taking the booster dose, also people got the same kind of situation. People developed a fever, so once again, and they spread the fever to others also. And that's so the second wave of COVID has happened. So that means that the first wave and second wave was artificially produced by the vaccines, and not really the original disease itself. So this is the tragedy of that kind of treatment, that kind of preventive methods. But when those who took homeopathic medicine as preventive have no such secondary problems, or never developed such kind of high fever in that way. So the number of death during homeopathic preventive was less comparatively when we compared it with that of the vaccine people who took vaccines. So this is also another point. This is how we need to look into the community medicine. In conditions such as in those conditions where preventives are required, if people come towards homeopathy, we can have a better solution than any other thing. And that's also happened that at the time of chikungunya also, we have proved that homeopathy works in a better way than any other preventive system. Dr. Sweta, what's the condition of in your land, whether it is or these preventives are working in a good way or not? Whether you people are giving any preventive from government side?
Uh, Doctor, actually, your voice is breaking.
Okay. Okay, that's that's your network is weak. That's the reason.
Yeah.
No problem. Okay. Tomorrow we will have a session from Dr. Gopal Reddy, and that's another big subject for tomorrow. Okay, about that. Tomorrow's subject is mental block syndrome. Dr. Gopal is Sadhya. He has completed MD and MRCP and physician and behavior scientist at USA. So he's a very good person who is coming to our forum. Even though he's an allopathic doctor working in USA, he's interested in our forum. He is very much interested with our forum and is working in a good way for us. So hope all of you will be joining tomorrow also. Dr. DILEEP Gujaria, sir, can you speak something? No. I am
Doctor,
inviting Dr. Mashood to say vote of thanks. Dr. Mashood, you can say something about community medicine as well as vote of thanks. Dr. Shweta, you want to say anything?
Doctor, shall we conclude the session?
Yes, just 2 minutes remaining.
Yeah.
Yes, Dr. Mashood, can you say vote of thanks? Please unmute, sir. So it is up to Rambaresu, sir. It's just a vote of thanks to Dr. DILEEP Gujaria and others. Please unmute, sir.
Very, very thanks to Dr. DILEEP Gujaria on behalf of Sound. Very, very thanks, Dr. DILEEP Gujaria. Describe the community medicine and knowledge of practice. So, community medicine is the important role in homeopathic science. During Corona, arsenic is a very good select the medicine and benefit of all man, all area. Yani whole world, the international famous of arsenic medicine during Corona. So very, very thanks behalf of IFPH, Puri team, Dr. DILEEP Gujaria. Thank you.
Okay.
Thank you.
Uh,
Sound.
Yes.
Doctor, can you hear me?
Yes, yes.